Bed transferring to wheelchair.
First thing we do is sanitizing our hand. Then gather all the equipment needed. First is the wheelchair, the gait belt, drape, the BP apparatus, and the bedpan. After we gather all the equipment needed, we will proceed to the patient. Lock the wheelchair. Then introduce yourself to the patient. Good morning, ma'am. I'm Stephanie, and I am your caregiver for today, and I'm here to assist you since your doctor advised that you have an X-ray scheduled for today. Then introduce to the patient the equipment you need before you do the procedure. This is the bedpan, ma'am. You can use this to pee before we go to X-ray room. Then we have the BP apparatus. We will use this to monitor your blood pressure before we proceed. Then we have here the gait belt. We will be using this later to support for your transferring ma'am. Then secure to lock the bed wheels. Then close the curtain for patient's privacy. Then check her blood pressure to monitor the patient before doing the procedure. You can ask the patient of how she is right now or talk to the patient to lessen her worries of her health before taking her blood pressure. Side rail down. Check her blood pressure. After taking the vital signs, tell the patient if it is normal. Don't forget to lock the side rails before leaving the patient. Offer bedpan to the patient. Down the side rail and tell the patient that you are going to transfer her to the wheelchair. Prepare the patient for a sitting position. Instruct the patient to cross her arms and legs, moving the patient to the side of the bed using the draw sheet. Move the patient to the side of the bed by segmental if necessary. Assist the patient to a sitting position. Hold back of the ankle, then pivot to bedside. Position the patient to sitting position at bedside while the palm at the bed for support. Position the footstool properly. Assist the patient to wear her footwear. Put on gait belt. Instruct the patient to inhale as you do the half knot of gait belt and ask if tightness is okay or not. Instruct the patient to hold at the back of caregiver's shoulder. Instruct the patient to stand up. Support the affected leg properly while standing at footstool. Instruct the patient to step down with her good leg first. Support the bad leg properly as you move down to the floor. Instruct the patient to move sideward with her good leg. Pivot, the client going to the wheelchair. Instruct the patient to move backward with her good foot until she feels the wheelchair. Ask the patient if she feels the edge seat of the wheelchair. Instruct her to hold the armrest of wheelchair for support. Instruct the patient to sit down and support the patient properly. Place bad foot-to-foot plate followed by a good leg. Untie the gait belt. Fix the bed. Position at the back of the patient. Ask the patient to lean forward. Support the chest of the patient as she leans forward. Remove the gait belt and insert at the back pocket of the wheelchair. Remove the draw sheet at the back of the wheelchair. Drape the patient properly below her knee. Remind the patient for the destination to the X-ray room. Unlock the wheelchair. Face the door. Lock the wheelchair. Open the door and observe any obstacles before going out the door. Unlock the wheelchair and go out of the door. Lock the wheelchair. Close the door. Unlock the wheelchair and proceed to X-ray room. From X-ray room, face the door, then lock the wheelchair. Open the door. Unlock the wheelchair, then back inside the room. Lock the wheelchair and close the door. Unlock the wheelchair. Position the wheelchair near from bed. Lock the wheelchair. Remove the draping and fold properly. Position at the back of the patient. Support the patient at the chest as she leans forward. Ask the patient to lean forward as you support. Inform the patient to insert gait belt. Let the patient lean at the backrest of wheelchair. position properly in front of patient and do the half knot. Instruct the patient to inhale as you do the half knot of gait belt and ask if tightness is okay or not. Fold the foot plate. Support bad leg at the side. Instruct the patient to hold at the back of caregiver's shoulder for support as you assist her to standing position. Hold the gait belt properly and instruct the patient to stand up. Instruct the patient to move her good leg sideward towards the footstool while supporting bad leg at the side. Pivot the patient in front of footstool. Ask the patient if she feels the front edge of footstool. Caregiver must position her foot at the bad side of the patient. Instruct the patient to raise the good leg to the footstool. Assist the patient to sit down, holding the gait belt. Instruct the patient to position her palm at the bed for support. Assist the patient for removing her footwear. Remove the gait belt. Cross the leg. Instruct the patient to position the palm at the bed to support. Pivot the patient to bed. Assist the patient to supine position in bed. Remove cross legs of the patient and position it properly. Drape the patient properly. Don't forget to up and lock the side rails. Ask the patient for any medical complaint. We are done, ma'am. Do you have any complaint, ma'am? If there is, I'm in the nursing station. You can call me later for anything you need. Thank you for watching.